The views and opinions expressed in the following program do not necessarily reflect the policies and the
Viewpoint, together with experts and newsmakers, will make sense of the week's biggest issues and stories. I'm Barnaby Lo. In tonight's conversation,
While nurses at government-run San Lazaro Hospital continue to work, a number of them left their shoes outside along the hospital's driveway as a sign of protest last week. Since then, other healthcare workers have followed suit. They say they're overworked, understaffed, and underpaid. Thousands among their ranks have also been infected with COVID-19, which they blame largely on the inadequate supply of protective gear. But the health department says PPEs aren't in short supply. Staffing and salary concerns are also being addressed. Meanwhile, Malacanang's assessment of the country's coronavirus situation, concerning but not alarming.
welcome once again to our program. And tonight we will be tackling a very timely and a very important issue, which is the concerns of our medical frontliners amid this pandemic. And tonight we have two guests who will be joining us by Skype. First, let me introduce you to a nurse who works at the San Lazaro Hospital. She is an active duty nurse, Jaymmee de Guzman. Welcome to the show, Jaymmee.
Hello, good evening all. Thank you for inviting me.
And joining us as well via Skype, like I said, is the national president of the Alliance of Health Workers, Robert Mendoza. Good evening, Robert. Thank you for joining.
Hello, good evening, and welcome. I would like to welcome all the listeners, the viewers of this program.
Okay, so for the next half hour or 45 minutes, maybe we'll go all the way to an hour. We will discuss the many issues that have come up the past week or the past 2 weeks with regards to problems of healthcare workers there to be in the different hospitals here in the Philippines. And when we have time, if we have time rather, we will take questions from our viewers. So you may type in your questions in the comment section of our Facebook page. We are live, of course. All right, Jaymmee, sa'yo tayo magsimula, no? Kasi ikaw
Yes
yung
po. Wala na mamansin, nilagay ko sa salit na
at
mamansin.
itong linggo, hindi yata itong linggo na to, no? Last week yata, no? Nagsagawa kayo ng protesta. Pero silent protest ito sa labas, doon sa may driveway ng San Lazaro, if I'm not mistaken. Madalas naman ako nakakapunta sa San Lazaro, so familiar ako dun sa. Tapos nilagay ninyo yung mga sapatos ninyo. I believe, sapatos yun talaga yon.
Opo.
Oh, yes. So nilagay ninyo yung mga sapatos ninyo sa labas, doon sa may driveway ng San Lazaro Hospital. Ano yung symbolism nito? Bakit ninyo ginawa ito?
A week prior to that, we already released a statement via the Filipino Nurses United regarding the miserable situation of the nurses, especially in San Lazaro Hospital. And we believe no one was listening. And we have to show everybody that we are really losing healthcare workers, especially nurses. So we decided, we got this idea from, I think, from the US. A group of nurses from the US made the same event, but at this part, ang ginawa nila yung shoes, white shoes nila symbolizes the departed or the victims, the dead nurses as, who were victims of COVID-19. But this time, it was a symbol of showing that we are really human beings, that there will come a time that there will be no nurses to attend to the needs of these patients. And we placed it in front of the flagpole, and unfortunately, it was a bit raining. It's 8 in the morning, so the flag was not up. And strategically kasi yung flagpole, yun yung center of ano namin, ng hospital namin. And we know that everybody who goes into the hospital will see it. And we were overwhelmed with the impact. Kasi talagang sinasabi nga namin na we are not robots. The time will come that we will get sick and we are not, and we are prone to get infected with the exposure. And we cannot raise our voices kasi nga hindi naman namin gusto ma-disturbing yung service namin and it has to be an activity na very symbolic pero we have to move fast kasi pinapalayas kami ng admin na yung COA namin, yung Chief Administrative Officer namin, pinapaalis kami, wala kami permit. At that day din kasi, unfortunately, one of our co-employee from the maintenance, he was about to retire for a few months. Unfortunately, he died because of COVID infection. And talagang medyo ang mood namin was before naaawa kami sa sarili namin, pagod kami. Pero at this point, we are more of angry. Kasi no one's paying any attention. And that day, marami pa po siya dapat na shoes. Talagang around 100 shoes. Pero pinapaalis niya kami, wala kami permit. Yung president ng FNU from San Lazaro Hospital, nung bumaba nga siya, after nakapag-speak na kami, she was holding like 3 more bags. Kinuha po namin yun from the area. Yung mga shoes nila, talagang pinadala nila. Kasi we cannot be there dahil we don't want this to disrupt yung service namin for the patient. And we were very thankful na it was a one sentence, one picture, but it was able to depict kung ano yung feelings ng mga nurses, how scared we are, and how angry we are with the current system na hindi talaga naaalagaan yung mga nurses.
So yung
and the healthcare workers.
So yung pinaka-concern ninyo is parang nalalagay na sa alanganin yung mga buhay ninyo. Tama?
Yes, very true, sir. Very true. We were in danger, in grave danger, but no one was looking. Parang they're turning their heads away, maybe due to the pressure from the Department of Health or from the President himself, without taking any measures to protect us and ensure that we will continue.
I'll be the devil's advocate here because wala naman yung DOH dito sa discussion natin. So, para fair lang, kinuha ko kasi yung statement nung San Lazaro. So, sa bawat ibabato mo sa admin ng San Lazaro at sa DOH, ibabato ko naman yung sinabi nila. Okay? So, ang sabi mo, nalalagay na sa alanganin yung... Robert, babalikan kita ha. Sorry Pero dito muna tayo sa nangyayari sa San Lazaro. Kasi sa tingin ko kung ano yung nangyayari sa San Lazaro, maaaring nangyayari din sa mga ibang hospital. So, tingnan natin muna kung ano yung nangyayari sa San Lazaro. So, sabi mo, may namatay nga na maintenance nung araw na yon. Tapos sabi mo, delikado na yung kalagayan ninyo doon. Sabi ng admin ng San Lazaro, the 40 health workers that you had mentioned in your statement na nagka-COVID is cumulative. Kumbaga, hindi active cases. So kumbaga, ito ay 40 from March hanggang July. Okay.
No, sir. That's not true. I think they're getting the numbers wrong. From the time we made the statement, from March until that time we released the statement, there were 67 employees who got positive for COVID. Starting July alone, for the month of July, there were 40 cases at that time. But as we speak, unfortunately, that 40 cases have blown up to 80 positive cases. Imagine how fast, that's why we were really bothered and we were really worried. And we had to speak out. But even if we did, wala pa rin naman talagang nangyari.
Confined
unfortunately.
Ito or home quarantine or paano?
Last time I checked, there were 81 patients admitted for COVID and 60 of those are employees. And,
wow. That's
and not all the employees had the chance to get admitted because of the lack of availability. The vacancy was not available for the employees because we were already overwhelmed at that time. The only reason we agreed to open the other was that the Atlantic was because we were concerned of our co-employees. Some had to wait for 3 days in the holding tent. Imagine, you are positive, and then meron kang symptoms, and you're not feeling well. For
Mhm.
3 days, you had to stay in the holding tent. Meron pa kami isang case na naging
Mhm.
critical condition yung isang nurse namin.
Mhm.
He was staying at the dormitory, but he had to go back like for 2 days back and go to the COVID triage just to check kung meron ng available. And he was not feeling well. He had fever, he had cough, and he was really feeling weak. Pero after the third time na bumalik siya, that was the only time he got admitted. And diretso siya sa ICU. Sa ICU ang binagsakan niya. Kasi
Oo.
talagang masama na yung pakiramdam niya, pero he had to wait for vacancy. That's how worse it is. Yung iba, 12 hours, 2 days, makikita mo how miserable they are. Ikaw, feeling mo you're an employee, and yet, this is the time that the institution can give back to you yung service mo for all those years. But unfortunately, when you needed that service, hindi mo ma-avail because walang bakante.
Oo. Pero sa ibang ospital, wala rin bakante, no?
Yes, we understand that, and it was expected, sir. We have, it's not just yesterday, not just last week, not just last month. We are in 6 months into this, and how come no one is prepared? Parang they're just waiting for it to blow over and finally be done with, na matapos yung virus. But we're not seeing any light at the end of this tunnel. Wala pa tayong malinaw na katapusan ng virus.
Robert, ganyan din ba yung nakikita mo sa mga ibang mga ospital? Ay. Naka-mute yata si Robert. There. Yan. Okay.
Okay.
Yes.
Yung sinasabi ni Ma'am Jaymmee, hindi lang yan sa San Lazaro. Halos lahat ng mga DOH certain hospitals, especially sa NCR, yan ang nangyayari talaga po. Kasi every now and then, meron tayong, dahil lahat ng mga unions, mostly ang mga unions natin from DOH certain hospital are affiliated sa Alliance of Health Workers. Every now and then, meron kaming group chat. Kaya na-update yung ating national office. Ano bang nangyayari sa mga DOH certain hospitals? Ano nangyayari doon sa mga protocols na napapractice ba ng maayos? So, parehas po. At natutuwa nga kami kasi dahil lumabas si na Ma'am Jaymmee, magsabi ng totoo talaga kung ano nangyayari sa mga papublikong ospital natin. Kasi tinatago ito ng ating mga nasa Department of Health. Kung, parang feeling nila okay lang ang mga health workers. Pero umaaray na yung mga health workers. Marami na ring tumaas. Lalo na ngayon, NKTA nga natin, nakikita natin, ang dami talagang halos kalahati. Kalahati ng mga empleyado. So, talagang nangyayari po ito at dapat mailabas na ito ng mga health workers kasi every now and then, kami sa national office din, naglalabas din kami ng mga press statement para mapakita sa gobyerno natin, sa Department of Health na ito na yung kalagayan talaga ngayon ng mga health workers ng ating mga health facilities.
Pero sa government hospitals lang yan o pati sa private hospitals?
Kasama ang mga private hospitals din, ganun na rin sila kagaya ng St. Luke's Medical Center, QC at saka Global City. Mayroon din silang update na binibigay sa atin para kung ano na yung nangyayari sa mga health workers nila.
Oo. Okay. Jaymmee, ano ba yung pinaka-dahilan kung bakit nagkakasakit yung mga nurse? Sorry, Jaymmee. Naka-mute.
Prior to COVID, sir, actually, ang health system natin really is failing in terms of healthcare workers, in particular sa mga nurses. We know that for a long time, the nurses are underpaid and overworked due to understaffing. Maraming vacant items for nursing position, but still they are unfilled for some reasons na hindi namin maintindihan. And when we look into it, itong COVID, just last Thursday, we had a chance to speak with the Chief Administrative Officer, Engineer Calma, kasi nga si Director namin Edmundo Lopez was not available. We insisted that the 40 positions, unfilled positions, should be filled in order to augment the need of to answer for the need of understaffing. Kaya lang ang problem kasi, even if we were trying for how many years, shouting it in the street and in print and via the media, no one is listening. And now comes COVID, mas talagang na-aggravate yung situation. Hindi na kami, overwork na kami prior to COVID. And the only reason was na nakalaban pa kami is due to the warriors in our heart. The adrenaline, yung spirit namin na we had to fight whatever we have to do in order to contain the virus. But unfortunately, we were left unattended. Hindi kami pinapansin. Yung staffing stays the same, and either prior to COVID, there as much as one nurse for 60 patients nangyayari sa iba't ibang hospital.
Okay.
Sa TB ward lang namin, 1:40. Let alone COVID, wala na kaming energy talaga. And it's amazing that we were able to continue until now.
So on staffing, ang sabi sa statement ng San Lazaro admin, sabi sa statement hindi daw understaffed, that we are following the standard nurse to patient ratio. At ang occupancy rate daw ngayon sa COVID ay 20%, at kung noon naman daw ay 80 to 100%, sa dengue, measles, leptospirosis ay kinakaya naman daw. In so many yun yung sinasabi. Yes.
Well, to answer first, let's define the difference between handling a COVID patient, may HPV positive or a suspect, to a measles or dengue or a leptospirosis patient. Like a year ago, nagkaroon ng measles outbreak, we were able to handle more than the ideal nurse patient ratio of 1:12. Ang admission namin for 8 hours, every 8-hour shift was like 40 measles patients. But we were in like 3 months to 4 months into the measles outbreak, and no one heard about it. And no one knew about it. No one was complaining because we felt safe, because we know measles is an ODP. There is a vaccine, there is a therapeutic management na alam natin effective. And if you get infected, you get immune. So walang reinfection compared to the COVID. Sa disease pa lang yan. Yung suot namin PPE. For measles, you're okay with a surgical mask lang. As long as nagka-measles ka na. If not, you can wear the N95. Sa COVID, you have to wear the coveralls. From head to foot, you have to be protected. The climate in the Philippines is hot compared to China, Korea, and anywhere else na malamig. Dito, if you have a chance to wear the whole type C, from coveralls hanggang sa foot covers, goggles, face shield, and N95, you will realize without even moving, I gave you 15 minutes of standing, and you will feel suffocated. And you will perspire.
Ilang beses
That's
na
how difficult it
yan.
is.
Yung cover.
Yes, sir. Diba? See?
Kasi nagko-cover ako sa loob ng ospital eh. So, kailangan.
Yes.
COVID ward, di ba? Kailangan. Alam ko yan.
and you have, yes, sir. Yun nga eh, sir. Buti pa tayo, we know eh. Sila kaya, have they tried it? Those officials in the upper positions, have they even tried to wear it? And imagine wearing that suit while pushing that stretcher up in the ramp. Performing strenuous activity, doing ambu bagging, CPR, lifting your patients and all, that's different. And as for nurse-patient ratio, iba po yung ideal na 1:12. That was designed for patients na walang masyadong needed care at walang masyadong need na paraphernalias or PPEs to wear. So 1:12 for COVID, that's unimaginable. Pinakamarami na po yung 1:3.
Sa lung center, parang ang kakaalala ko sinabi sa akin, 1:2.
Yeah.
Yung sa ibang wings, yung mas hindi severe cases ay 1:4. Acceptable sa inyo yung 1:4.
Yes. I think 3 lang talaga. 3 lang talaga. Pag nag-vital signs ka pa lang.
Tumatango-tango si Robert, so parang meron yata siyang gusto idagdag. Pero Robert, I want to ask you because the DOH said that they are actively hiring more nurses. So, are you seeing that their efforts to hire more nurses is enough?
Alam niyo po sir, kasi nakakalungkot po kasi matagal na tayong nasa deliberation ng budget sa Senate, sa Kongreso, Nakita natin na talagang maraming bakanting plantilla positions ng Department of Health. It's 13,068. Bakit hindi nyo finifill upan itong mga plantilla positions na ito na permanent? Bakit nag-hire kayo ng mga contractuals, mga job orders, contract of service, di ba? Ito ay sinasabi ng civil service, yung serbisyo natin ay importante doon sa pag-aalaga ng pasyente. Bakit tuloy-tuloy pa rin yung nurse deployment program, yung doctor to the barrios, na alam naman din nila na kailangan ito doon sa mga komunidad at dapat mag-hire talaga ng mga permanent plantilla positions kasi kagaya na lang sa NKT, mayroon silang mga CUS, mga contract of service, mga job orders, hindi sila nag-enjoy ng mga benefits ng mga regular employees, wala silang hazard pay, wala silang overtime pay. Mga frontliners ito, mga nurses din. So, sana maawa naman sila. Tingnan mo, ang sinasabi nga ni Ma'am Jaymmee, hindi talaga totoo na yung sinasabi na standard ng Department of Health na 1:12. Kung titingnan mo rin sa ibang hospital, lalong-lalo na sa National Center for Mental Health, 1:120, 1:200 patients. O paano pagkagaling ang pasyente natin? 'Di ba? Kaya pagod na pagod yung ating mga health workers. 'Di ba? Tingnan natin, yung iba nag-over nag-12 hours na dahil lang para ma-compensate doon sa understaffing. So, hindi talaga natutugunan ng Department of Health matagal na dapat i-hire talaga ang mga nurses, ang mga health workers natin, dapat regular plantilla positions. Anong ginagawa sa 13,068? Dati nga 26,000 pa yan. Pero ngayon dahil na-pressure natin ang Department of Health, kaya ngayon tuloy-tuloy ng pag-hire. Kaso lang, ang problema, contractuals pa rin ang hina-hire nila sa kasalukuyan. Kaya kailangan talagang fill upan yung 13,068 na bakante ngayon sa Department of Health.
Pagka-contractual ba, yung sweldo is kasi iba-ibang levels ng nurse yan di ba?
Ano po?
Di ba na-approve na yung salary increase? So that's good news, right?
Yeah. Pero pag contractuals ka, kagaya ng GOCC, nasa minimum wage ka lang, 537 yung sahod per day. Kahit nurses ka. Ang iba nga, napakababa pa rin. Kagaya ng mga nasa private hospitals, napakababa ang kanilang sahod at wala pa sa minimum wage ang kanilang sinasahod.
Oo. Si Jaymmee, meron kang gustong sabihin tungkol dun sa salary increase eh?
Yes. Isa po yan. We struggled and fought for it based on the Philippine Nursing Act of 2002. 18 years. Sabi nga nila, nag-debo na yung batas eh. And finally, ayon sa Supreme Court, na kailangan implement na in December, and it took them like 7 months before it reaches the hands of the DBM in order for them to design a guideline. And when they finally designed the guideline for implementation, we were so disappointed. It was very confusing. If you're going to read the article, medyo malabo. And the table itself, yung from nurse 2 to nurse 1, so ang nangyari parang, it's not clear kung nagkaroon ba kami ng demotion, kung yung nurse 2 ba namin, nagiging nurse 1, at nasan na napunta yung nurse 7 position to the staff position. And if that is talagang the proper implementation of this guideline from DBM, ang sabi nga namin, let us go back to the intent of the law. The law itself states that it is made to improve the wages, not just of the nurse 1, but the whole nursing profession in the government services. So, ang naset lang po doon is the baseline or the entry level. Pero, it means when the baseline is set or the entry level is set, the other positions should follow. Kaya lang up to now, wala pa kami reply from DBM with our formal clarification from FNU and from Alliance of Health Workers. Wala pa rin kami nare-receive. Tapos merong statement si Secretary Panelo, I think few days back, iba din yung interpretation niya, medyo favorable sa amin. Pero hindi ko masabing tayo po error na nawala yung nurse 7.
Okay, so
imbis na the guidance was set so we can be clarified kung paano implement. Masyado kami nagulong.
Hindi pa masyadong klaro, no?
Yes,
babalikan ko lang yung sinasabi mo tungkol sa PPEs. So, kulang ba yung PPEs ninyo? Kasi sabi ng DOH, enough naman daw yung PPEs para sa lahat ng government hospitals. Tapos sabi ng San Lazaro, ito yung N95 masks daw, meron naman supply that can last for a whole month.
Mag-start tayo sir sa supply.
Sabi mo kasi,
present supply,
Jaymmee, kasi ang sabi ninyo, yung N95, kailangan ninyong gamitin ng isang N95 na mask for an entire 12-hour shift.
That's true, sir. That's true.
Okay.
Beforehand, before that one N95 per 12-hour shift, ang nag-exist naming policy is one N95 libre that is good enough for 2 days. Every other day release. But before for it, what they did was give us a one N95 per 12-hour shift. And funny, pero when they said coming from the DOH na we had enough supply, but a few days after that statement, they gave us 4,000 plus N95. And we were shocked, not really shocked. We were glad that we were given, di ba? Pero you say we have enough, but then you give us more. Alam nila na may kulang kami, that's why they gave us more. But the thing is, talagang yung mga happiness namin lang for a short while When we checked the specifications, what they gave us was the industrial type of N95. It's not the surgical or medical N95, which is for medical use. Yung industrial type natin can be used for biological, has biological filter, pero it is for only emergency. So talagang walang-wala. But they said, sabi from Engineer Calma, na it is because there is a ceiling price set by the DTI and the DOH. And that ceiling price was the reason bakit nakatali yung kamay nila na hindi sila makabili. Kasi with the current market, due to the law of supply and demand, mataas yung presyo. And they cannot, we have the money, but they cannot buy kasi sa mga paperwork, yung mahabang proseso, although the President Duterte said the paper can come later, but because of the ceiling price, they cannot buy more dun sa nakaset. If it's 150 for the medical grade, kaso sa current market natin, nasa 250 to 300 So natutulog yung pera. Ang tanong namin, wala bang ibang way so we can cut through all those paperwork? Wala bang ibang way so we can find more funds para makabili?
So
kasi we have liquid donations from months.
So the PPEs are being held back by bureaucracy. That's what's happening. Yes, Robert. Yeah.
Kasi po,
And up to now, sir, kahit na merong binigyan DOH, ganun pa rin po. 1.95 per 12-hour shift. Wala nga pong nagbabago talaga.
Pero Jaymmee, sabi ng admin ng San Lazaro, okay lang daw yun na yung N95 for 12 hours.
No, it's not. Kahit po tignan yung specifications ng manufacturer, they would not advise it to be used for 12 hours. Wala
Robert?
pong ganun.
Okay. Totoo po yan, sir. Kasi kung nakikita po natin kahit sa mga GOCC hospitals like for example NKTI, talagang may nagkukulang pa rin yung ating mga PPEs. Kung dati nga nakikita natin talagang may nilalabahan ng ating mga tauhan sa NKTI yung kanilang mga PPEs. Kaya most of the time makikita mo sa likod ng NKTI may sinasampay ng mga PPEs. Kaya talagang maraming kakulangan pa rin sa PPEs. Kahit sinasabi nilang thousands na mga dinidistribute na kahit yung mga nasa regions, mga LGUs, walang PPEs yung iba dyan. Kasi like for example, sa amin sa Region 8, mayroong isang hospital na nanghihingi sila ng PPEs. Pinapagalitan pa sila ng chief of hospital nila dahil good for 1 week na daw po yung PPEs nila. Kasi ganun daw ang kanilang supply. Kulang talaga. Kaya
overall? For 1 week?
Yes. Yeah. Opo. Ganun ang ginagawa.
Pagka isang gamitan?
Dapat gano'n. Yes, after duty mo dapat itapon na yan. Pero sila, pinapalaban pa. At karamihan din sa ating mga doctors, mga ibang health workers, bumibili na lang sila ng sarili ng PPEs. Ito yung nangyayari sa kasalukuyan. Kaya nakakalungkot dahil, kaya nga siguro isa sa mga reason kung bakit tumataas din ngayon ang mga cases ng ating mga health workers na infect yung COVID, dahil din sa PPEs din siguro. Kasi yung iba nire-reuse or iba nire-regas. Kaya yun ang nangyayari po.
I remember back in March, ito talaga yung naging problema natin, yung PPEs, kaya maraming nagkasakit ng mga healthcare workers, and then we had doctors and nurses and other healthcare workers dying, no?
Yes.
In March. So are we seeing na baka ganun ulit yung makikita natin na scenario katulad nung nakita natin nung March?
Ganun po talaga mangyayari kung talagang hindi talaga bibigyan ng pagkalinga ang ating mga health workers doon sa usapin ng understaffing, PPEs, yung contractualization, kababaan ng sahod, Tapos yung pagbibigay pa ng kunwari pakonsuelo doon sa SRA, yung special risk allowance at saka hazard pay na hindi naman talaga nakakatugon doon sa pangangailangan talaga ng mga health workers. Kasi parang niloko lang yung mga health workers doon sa pagbibigay ng hazard pay at saka niloko talaga, hindi parang niloko talaga.
Hindi
Kasi
ko talaga, sir.
yeah, kasi ang DBM circular nagsasabing whichever is higher. Kasi normally nakaka-receive na yung ating mga health workers ng hazard pay based on the Magna Carta Public Health Workers. Pero ito dinagdag para kunwari matuwa ang mga health workers, mga frontliners. Pero kung susumahin, piso or katiting lang, ang barya-barya lang ang binigay. Kasi siyempre pipiliin pa rin yung malalaki namin, mayroon na kaming hazard pay from the Magna Carta. Kaya yun, panluloko pa rin ang ginawa para sa mga health workers.
Yung 500, Jaymmee, yung 500 pesos per day na hazard pay, under
Opo.
Bayanihan Law, di ba?
Opo.
Hindi nyo nakuha yon ever?
Nakuha po namin yon. Pero since kunwari ako, nurse 2 ako, SG 15, 25% of my salary minus the taxes would equal to around 8,000 per month of hazard pay. That is for 20, ideally for 20 days. If you're just going to complete for 20 days ng duty mo, kung 500 plus 500, if you're going to choose yung 500, it will equal to 10,000. So, set aside yung mga taxes, 2,000 malinaw ang marireceive ko dapat. Pero since may mga taxes, 1,000 lang po yung natanggap ko. So, I have my regular hazard pay of 8,000 plus 1,000 only. So, ang feeling namin mga nurses is this 1,000 my worth.
1,000?
Ito ba yung 1,000 lang po ang nadagdag sa current hazard pay ko dahil
kasi 500 or higher. Meron ba?
Yes, po. Opo. Mas higher po yung 500. Pero ang difference lang is 1,000. Lumalabas, 1,000 lang po ang nadagdag sa amin ng COVID hazard. Yun yung COVID hazard pay, 1,000 pesos. Imagine the insult you feel na nakaharap ka dun sa mga positive na pasyente, critical care, tapos makukuha mo 1,000. Kulang pa yung pambili ng mga binibili.
Kasi may mga nakita ako mga nag-post na gusto ko nga tanungin kung fake news lang yon. May mga post na mga payslip na ang hazard pay nila nasa 100 pesos lang.
Yes.
Meron po. May tinakpin siya kasi, sir.
Oo ba yun? O,
opo,
kasi,
totoo po yun.
News ngayon di ba? Madaming, pero totoo yun.
Sir Barnes?
Opo, totoo po yun.
Yes, Robert.
Yung hazard pay at saka yung SRA under AO 26 at saka AO 28, parang talagang siya mapanghati at mapanlinlang kasi yung batayan nila is depende sa exposure, 1 to 7 days merong ganito. Dapat hindi kasi kaya ngayon may ang Alliance of Health Workers sumulat sa Kongreso at saka sa Senado kasi nagda-draft na sila for bayanihan to So ang panawagan namin doon, nirecommend namin na dapat yung hazard pay under the Bayanihan Act dapat gawin siyang regardless of exposure, regardless of salary grades kasi nung kino-compute na mas malaki pa nga yung mga nakukuha ng mga matataas na mga nasa position kumpara doon sa mga frontliners sa direct patient care. Kasi ang mga health workers natin minsan 3 days lang pumapasok. So mag-off ng 4 days. Ang mga nasa admin is 5 days lang pumapasok. Mas malaki pa ang kanilang hazard pay kasi 500 pesos per day. Sana, kaya nga nirekomenda namin na dapat ito ay gawing across the board, na dapat ibigay ito ng 500 pesos per day na kahit hanggang sa wala pang vaccine, dapat tuloy-tuloy kasi inihinto na po ito hanggang noong May 15 lang. And then, ang panawagan din namin na kahit nag-positive ka ng COVID, hindi regardless din ng severity, either mild, moderate, or severe, dapat mayroon kang 100,000 talagang matatanggap. Kasi buhay ang nakasalalay dito sa pag-aalaga ng ating mga COVID patients din.
Sir, to add on totoo yan. Ako, sa amin sa San Lazaro, nung lumabas yung COVID hazard pay, nakita namin 1,000 lang yung nadagdag sa amin. Hindi kasi siya sinabay sa hazard pay, talagang nakaseparate siya. So, 1,000. Tapos yung mga iba from the lower salary grade, na tax exempted, na walang exposure, ang lalaki nakuha, 7,000, 8,000. Medyo nagkaroon talaga ng samaan ng loob. Pero nilinaw lang namin na huwag tayong magmahati kasi hindi naman natin kasalanan to. Kasalanan to nung naggawa ng guidelines at nung batas, hindi tayo may kasalanan, hindi nila ginusto. Okay na kami kahit na critical kami, naka-expose kami lagi. payag na kami sa pantay. Kahit sa pantay na kami nung hindi na-expose at na-expose.
Right.
Wag lang naman po yung mas lamang pa yung yung hindi
Ano?
na-expose kaysa na-expose. Ano po
Yes.
yung sense ng appreciation doon?
Mm.
Yung sa working hours, Jaymmee, sabi ng admin ninyo, pumayag naman daw sila na less days yung in a week, yung work, tapos more rest days. So okay na kayo doon? Nagkasundo na ba kayo doon sa working hours tsaka sa working days?
Actually, sir, if you're going to review statement namin, we never mentioned that we were complaining of the 12-hour shift. We were complaining of the fact that they were issuing 1 and 95 per 12-hour shift.
Okay.
We agreed to the 12-hour shift because sabi nga ni Sir Robert, it is an answer to understaffing. Nag-merge. Naging dalawa na lang yung shift, so nadagdagan to augment. Pero it should have been a temporary deal na
Yes.
pag na-augment, we can go back. Wala na nga kaming quarantine days eh.
Yes.
Hindi katulad ng iba, 7 days duty and then 7 days quarantine. Or 7 days duty, then 14 days quarantine. Sa amin po, ang quarantine period namin is non-existent. After we are exposed for 15 days sa COVID ward, we get a swab. Ito yung system namin like a month ago. We get a swab and then we go back, return to work immediately. So, wala kaming quarantine.
Di ba pag
So,
na-swap,
habang wala kaming
habang
dapat po.
dapat naka-quarantine.
Yes. Ang waiting period namin is spent at attending our duty sa regular ward. So kung mag-positive ka, marami ka na na-expose. And ngayon, continuous pa rin yung nila, yung system kahit sa employees medical service, magulo pa rin yung guidelines. Like sa DOH, sabi pag nag-swab, dapat 14-day quarantine. Sa amin, kahit hindi tapusin yung 14-day quarantine, kahit 3 days, 5 days ka pa lang, at nakakaroon ka ng negative, papabalikin ka agad sa duty. It's supposed to be 14 days. Hindi ko alam kung, yes, dahil understaff. Yung talaga understaff.
Okay. Kasi sabi ng DOH, Robert, may quarantine leave naman daw at yung quarantine leave, paid. So, hindi nangyayari ito sa lahat ng mga ospital?
Nangyayari po ito sa mga pero merong mga hospital na hindi nag-i-implement po kasi sinasabi naman ng civil service meron din silang joint circular na yung quarantine leave talaga is paid pa rin yan. Pero other hospitals hindi nila ini-implement itong mga policies ng Civil Service Commission. Kaya kailangan talagang busisihin at titingnan natin yung mga bawat hospital kasi marami na rin, kaya sinabi ng Jaymmee hindi natatapos yung 14 days dahil sa understaffing, pinapa-report na siya. Ngayon, ang nangyayari, kahit negative ka, kahit asymptomatic ka, siyempre, droplets yan eh. Ginaano na nga nila, marami talagang kakalat talaga ang virus na ito kasi hindi nila binibigyan ng pagpapahalaga yung kalusugan ng mga health workers. Kaya nakakakalungkot kasi hindi lang ito nangyayari sa San Lazaro, other hospitals. Kaya nga, ang ating Jose Reyes Memorial Medical Center Employees Union nakipag-usap din sa director kasi ang sa kanila din ay isa-swab ka, pag nag-positive ka, magka-quarantine ka. Ang gusto nila, pagbalik nila para makita ng doktor na fit to work ka na, i-reswab ka para makita talaga kung ano ka na talaga, negative ka na. Kaya yung ibang hospitals, hindi na nila nire-require yung reswabbing. After 14 days, pasok ka na agad. Kaya nakakatakot eh. Kasi hindi mo alam kung nag-positive ka pa ba or negative ka na ba, di ba po?
Totoo ba yung yung mga ibang nurse ay pinagduty both sa non-COVID saka COVID? Pinaglilipat pa. Totoo yan.
Tawag po doon, bunot. Bunot po ang tawag doon. Dahil pag understaff sa COVID area, bubunot. Kunyari ako, understaff, kahit hindi ka naka-assign sa COVID at nagpapahinga sa regular wards, pwede kang hiramin sa regular wards para mag-duty sa COVID area that night or that day. Kasi to augment yung staffing. And then the next day, doon ka ulit sa regular wards.
Okay. Parang that sounds very risky both for the health workers and for the patients, Because if you're a patient in the non-COVID ward and you have a nurse taking care of both a COVID patient and you in the non-COVID ward, then that makes the patient in the non-COVID ward vulnerable to contracting COVID, right?
Yes, that's true.
Okay. Wow, madami problema.
Ang
Yes,
dami po
sir.
talaga, dami
Oo,
talaga.
madami problema.
Emphasize ko lang din, sir, despite the problem with the understaffing, the pressure from the DOH to provide or to allot 30% of the government hospitals bed capacity
Mm.
for COVID patients, talagang medyo mabigat yung pressure na yon. Like for us, 30% for 500 would equal to 150. Pero in reality po, dun sa 500, meron pa kaming regular patients.
Yes.
At meron kaming separate na pavilion for tuberculosis patients na umaabot din ng around 120 to 150 ang bed capacity. So, at the point of 65 patients, overwhelmed na kami. Pero we still have to answer and cater dun sa respond na kailangan kahit anong orders sila, yun yung pressure. We have to provide 30%. Kahit kulang tayo ng manpower. Like, for example, yung tinutulan namin ward na mabuksan, binuksan pa din po yun. 37 ang ginawa nilang bed capacity for that ward. During, last week, ang inassign lang nurses were 12 nurses. So, if you're going to divide it into 2 shifts, 6 nurses na lang. Kung hahatiin ulit natin sa gitna, kasi you have to take a day off dahil ang kaya ng scheduling namin is 2 days duty, 2 days off. So, 3 na lang. So, 3 divided by 37. Ano na po ang nurse patient ratio natin? That will be 1:12.
Oo. So sa makatuwid, pag pinag-uusapan natin yung capacity ng ospital, hindi lang yung bed, kasama doon yung staffing. Kasi,
Yes.
Yes, sir.
tama ba? Correct me if I'm
Yes,
wrong.
sir, dapat.
Nyo, kahit may bed, kung walang nurse or kung kulang ang doctors, then ano naman yung gagawin nung bed o kaya nung ventilator? And I'm asking this because sinasabi ni presidential spokesperson Secretary Harry Roque na dinagdagan na raw yung mga bed capacity for COVID. So kumbaga, ang sinasabi niya ay yes, at one point critical capacity, gaya nga ng sinabi ng DOH, hindi naman dininay ng DOH yan, critical capacity at one point, but recently Secretary Roque said that capacity is already improving because they're adding more beds for COVID and they have enough ventilators for COVID. And then, just today, Congresswoman Niña Taduran said na okay, kung puno yung mga ospital sa Maynila, bakit hindi natin i-transfer yung mga pasyente doon sa mga ospital sa probinsya?
Yan.
Robert.
Ayan, nakakalungkot po kakaiba talagang pag-iisip ng ating mga congressmen Kasi instead na lakihan ang budget para doon sa ating mga hospital, kagaya for 2020 almost 10 billion ang kinatang budget para sana ito ay modernize ang ating mga hospitals. Ngayon, dahil nag-uumapaw na yung ating mga hospital sa NCR, bakit hindi dalhin sa mga probinsya? Nakita rin natin sa probinsya, umaapaw na rin yung mga pasyente natin doon. At kulang din ang ating mga health workers doon. At may kulang ang pasilidad, like for example, ventilators. Wala silang mga ventilators ganoon sa mga probinsya. Kaya nga nire-refer nila dito sa malalaking tertiary hospital. At every provinces, isa lang yung regional hospital. Like for example, sa Region 8, Samar, Leyte, Biliran, isa lang yung provincial hospital, yung Avery RMC, Eastern Visayas Regional Medical Center. Kulang pa rin ang mga facilities doon. Bakit mo sabihin na ililipat ka lang sa mga regional hospitals? Ang gawin sana dito, like for example, ngayon kasi tuloy-tuloy na rin yung budget hearing kasi after ng SONA, tuloy-tuloy. Dagdagan talaga ang budget ng para doon sa mga pampublikong ospital, para sa Department of Health, para sa pampublikong ospital, at yung budget para sana sa PhilHealth, hindi na ibigay sa PhilHealth. Diretso na ito doon sa mga hospitals kasi ang mga hospitals ang nakakaalam kung sino yung mga pasyenteng nangangailangan ng tulong talaga. At para doon sa MOE, Maintenance Operating and Other Expenses, sana taasan ng budget ng ating mga ng Department of Health, ng Kongreso, ng Senado, ang ating mga GOCC hospital din kasi alam natin yung GOCC hospital napabayaan na yan ng gobyerno kasi ang binibigay na lang nila na budget doon sa GOCC hospital, heart, kidney, lung, PCMC ay 30% na lang doon sa maintenance, operating and other expenses. Ang pasahod sa GOCC hospital ay nagagaling na sa kita nila. Yung pagpapaayos nila ay nagagaling na rin sa kita nila. So, ang 30% na binibigay doon para sa mga pagpapaopera ng mga pasyente, magkano ba ang kidney transplant? Milyones din, ang heart transplant. So, iilan lang yung pasyente ang nakikinabang doon sa mga budget na yan. Kaya talagang kailangan by the year 2021, doblehin o triplehin pa at mayroong recommendation ng World Health Organization na dapat 5% of the gross domestic product ilaan para sa ating health services, healthcare delivery system po. At the same time, dagdag ko lang sir, panahon na siguro na dapat, kasi fragmented yung ating healthcare system, dapat panahon na yung renationalize. Ibalik na sa national yung ating mga healthcare delivery system, yung ating mga health facilities sa Manasa, yung mga devolved, kasi sila rin napopolitika sa mga LGUs. Hindi makapag-react yung ating mga health workers dahil once na mag-react ka, pwede kang i-reassign ng mayor, ng governor, kung saan-saan na lang. Kaya mas maganda talaga ibalik sa central office, renationalize yung ating healthcare delivery system.
And sir,
Jaymmee, yes.
If we're going to stick with the guidelines ng World Health, once you are tested positive, talaga nililimit natin yung movement, yung mobilization ng mga positive patients, and with juries transferring this huge number of patients to hospitals na kukunti lang ang pasyente, na kaya nga konti ang pasyente nila dahil they were able to control yung number ng positive at tataas-taasin natin number. There is higher. There are other ways. Augment nga yung budget, hire more people, and most importantly, hire people that will enjoy a permanent plantilla position. Kasi pagka temporary, voluntary, or minimal lang bayad, ano to, suicide?
Actually, I was gonna ask you, sinasabi nyo, hire more nurses, right? But in reality, our nurses, they want to go abroad. And we have a lot of nurses right now who are complaining that they already have been hired by these hospitals abroad, but because of the lockdown, because of the pandemic, and at one point because of a ban by the government, they couldn't go to where they needed to go to fulfill their contracts. So, paano po ba itong reality na yung mga nurse natin sa abroad nila gusto magtrabaho eh. So, hindi naman talaga, kumbaga ang hindi naman nila goal na ma-hire dito sa Pilipinas. Di ba? Parang problema din.
Yes, sir. Kasi ibase na lang natin sa compensation, sa wages. We're going to take the same risk, but you're going to get paid higher. Real talk lang. You would choose the high paying. Why risk your life? And this is not a question of patriotism. Hindi ko ganun. Kasi you will still be serving humanity. And at the same time, kahit paano naman, maayos yung maging kalagayan ng buhay ng pamilya mo at mas mataas yung sweldo mo, you would take the other option. But if we were offered the same options here in the Philippines, there would be no reason for the flight of these nurses, despite this pandemic. Nakikita mo naman, yung hukog sa hazard pay, kahit pala magbabad ka, $1,000 lang ang dadagdag sa hazard pay mo. Tapos doon, $2,000 yata ang bigay nila per month additional for the exposure sa COVID patient. That's a huge difference. Hindi nga na driven, pero if we're going to risk their life, it should amount to something at the very least kahit na ibase natin sa monetary.
So what is your opinion about this ban on the deployment of our nurses to abroad? Dapat bang paalisin na sila?
Yes, they should be allowed to go overseas and work because we cannot offer them the same compensation in the wages. We cannot even compete just a very little bit. Yes, despite the pandemic. Even if you allow all these nurses who are already under contract overseas to actually work, we still have tons of nurses here in the Philippines. But we lack the encouragement for them. We offer them differently. Instead of a permanent plantilla, we offer them voluntarism. We offer them temporary work. But if they are offered a permanent plantilla, maganda ang sweldo, you enjoy the same benefits and more, they would stay. They would prefer. Hindi tayo mag-ubusan ng nurses kahit paalisin natin yung mga may kontrata. Marami tayo dito. Ayaw lang nila kasi parang nagagago sila. Parang binubuhay sila.
Okay. Medyo kulang na tayo sa oras, ano? So, but I want to ask you about the government response. Kasi at one point, sinabi ni Secretary Roque na the situation is concerning but not alarming. Para sa inyo, tama bang assessment? Robert?
Sige. Alam niyo po, itong si Secretary Roque kasi, kung ano lang sinasabi niyang gustong sabihin niya. Kasi kahit sinasabi na nga ng mga UP expert na ito na yung sitwasyon natin. Kahit nga si Dr. Yatson na pinaresign nila kasi nagsasabi siya ng totoo kung ano talagang totoong nangyayari sa mga datos natin. Kaya hindi talaga kapanipaniwala. Kaya nga other doctors are affected na sa sinasabi ni Secretary Roque, parang hindi na sila nire-respeto, parang dahil apektado na rin sila. So, hindi yung concerning talaga, alarming na talaga tayo kasi the fact na mayroon ng tumataas daily ng mga data ng ating census doon sa cases ng COVID-19 very alarming na. At the same time, hindi talaga pinapahalagahan yung mga health workers din at the same time sinisisi pa yung mga tao bakit tumalabas, di ba? Yung sinasabi nga nilang ayuda, asan na yung second tranche na ayuda o second wave nila? Gutom na rin ang mga tao, marami nagugutom na mga jeepney drivers na ang ano nila is to phase out. Tas ang daming nagugutom na tas tuloy-tuloy yung mga demolition. In fact, kahit yung IATF may sinasabi na bawal ang demolition sa panahon ngayon, pero tuloy-tuloy pa rin yung nangyari sa Laguna Kaya hindi totoo yung sinasabi ni Secretary Roque na talagang concerning, talagang alarming na tayo ngayon. Very alarming na tayo kasi halos tumitriple na kung titingnan lang natin dito nga as of July 23 16, marami ng infected na health workers, almost 3,738. Marami na ring namamatay pero hindi pa siguro ito na isasama yung mga nasa San Lazaro. Like for example, sa NKTI, kagahapon nagsabi lang si Dr. Liquete, nasa 134 at hirap na sila sa kanilang kalagayan. Sinasabi niya dahil parang pinapababayaan sila ng Department of Health. Kaya sinabi niya, kakayanin namin ito, parang wala nang support na nakikita sila sa NKTI kasi sinasabi rin na itong PhilHealth na ito, marami pa ring mga utang sa kanila na hindi na-reimburse kaya halos nauubos na rin ang kanilang resources doon sa kanilang pagbibigay ng serbisyo sa mga COVID patients. At saka yung mga health workers na rin na sana yung mga nag-positive, pangalagaan sana doon sa kanilang mga ospital ay inililipat. Ngayon, kanina nga, nagsabi nga na yung mga health workers from the NKTI ay titingnan kung mas okay na konti, ililipat na sa Makati, Sogo. Yung Salang Center pala, yung Salang Center, ililipat na pag okay na at marami na daw for admission na iba pa. Diba? Yung, may mga VIP treatment pa rin doon sa ating mga hospitals na dapat, priority dapat yung ating mga health workers. Kaya very alarming na ang nangyayari sa atin ngayon.
Si Jaymmee kanina natatawa kasi ikaw Jaymmee, ikaw talaga on the ground, ikaw talaga ay tumitingin ka sa mga COVID patients natin ano ba yung kadalasan ng mga dahilan kung bakit sila nahahawa? Pasaway ba talaga? Yung ba talaga yung bakit tumataas yung mga kaso natin?
Actually, for example, sabihin ba natin pasaway yung isang barangay chairman na nahawa? Hindi kaya dahil dun sa sa pagganap ng sa tungkulin niya bilang barangay chairman na bilapag naman talaga lahat ng responsibility sa barangay system, yung pag-handle ng mga COVID patient, pag-attend niya sa mga constituents niya, naging pasaway ba siya sa pag-aalaga, pagtingin sa mga pagganap sa tungkulin niya? Hindi. Yung iba nga, sobrang nag-ingat. At talagang, let's go back to the basics. It is no one's fault that we have COVID here in the Philippines. So if one gets infected, it's not the fault of that person because it shouldn't have been here in the first place. If the government were able to perform their duties in protecting the people when that epidemic became, once there was the news of that pandemic and it was brought to our attention, some measures should have been done. Earlier in February, sir, di ba, Sir Robert, we were together sa press con. Lahat ng nasabi namin doon, all of our fears, all of our concerns na future na magiging problema, it is all happening now because they never listen. So let's stop blaming the people that it's their fault.
Yes.
Because if the government...
Wala yung thought ni Jaymmee. Jaymmee.
If that is not alarming, I don't know what is.
Mm.
Yes.
Okay. Kasi sinabi ni Secretary Roque, Robert, na
Mm.
if the government did not do anything, then we would have more than 1 million cases now. So in other words, sinasabi ni Secretary Roque na the lockdowns worked.
Ah, hindi po yan totoo. Ang dami na pong perang nalustay dyan, ano, para doon sa pag-contain ng COVID, ano, virus. Pero parang walang nangyari doon sa mga ginawan ng mga protocols. Kasi kung talagang merong kagaya nga ni Secretary Doke, ano, kung ano-ano lang sinasabi na-flatten na daw or hindi pala to, parang ano lang
Nabent,
tumutulong. Yes,
nabent, no?
so kung
Secretary Duque, ano?
Secretary Doke, ano, Secretary Doke. At saka hindi talaga, ano, parang walang nangyari doon. 5 months na tayo, pero bakit patuloy na dumudoble, tumitriple ang data natin, ang datos? Ibig sabihin, walang nangyari kasi isa pa, ano, doktor, sana, ang problema natin is doon sa mga sakit ito, dapat hindi militarization ang ginawa ng ating gobyerno. Kasi alam natin na marami tayong mga doctors na mga experts para kontrolin itong ano. Bakit kasi hinayaan ng ating gobyerno na military ang mamuno dito sa pagkunti ng virus na ito? Na dapat, ang problema is medical, dapat hindi militar ang nandoon. Tingnan mo, kung sino pa yung mga nandiyan dyan sa gabinete ng mga militar, binibigyan ng tungkulin na important na tungkulin para doon sa COVID. Nandiyan dyan yung mga expert, from UP expert. Bakit hindi ka kumuha, mag-hire, magdagdag, o magpalitan yung mga kasi walang nangyayari. Sila pa rin hanggang ngayon at walang nangyayari doon sa pagkunti ng virus. Dumarami pa rin. Bakit hindi palitan at itry na si Secretary Roque mag-resign kasi wala talagang nangyayari sa kanyang pamumuno at talaga maraming mga lapses ang ginawa sa pamumuno ni Secretary Roque. Kami nga sa AHW, ano, wala pa itong pandemic. Yung nasa Department of Health pa lang siya bago siya pumunta sa Civil Service Commission, nananawagan na kami na mag-resign na talaga siya kasi ang dami niyang mga lapses sa kanyang pamumuno.
Si Jaymmee, do you agree with that, Secretary Duque's resignation?
At first, we were not really asking for anyone to resign, or we didn't make the statement to oust anybody. We were just trying to make people hear, especially mga people who can help us hear the real situation that's happening. Pero when you hear statements like, alam ko, nag-double term ako sa statistics ko because I was really good with it, but I never heard the term of bent. If you cannot do it, it's okay to say you can't. And you can always ask for help. Pero, iba kasi yung government eh. They do what they want to do just to save their faces. They cover up yung mga problema. Like with Harry Roque, it's not alarming. It's very insulting. And it's talagang demoralizing us na it's not alarming pala eh. Bakit pagod na kami? Bakit may gabing umiiyak na kami? Bakit gusto na kami pag-design ng pamilya namin pero the call of duty is in our hearts na hindi pwede kasi pag nawala kami, wala nang matitira.
Last
and
question.
For Secretary Duque, you know where you stand, you know what have you done and what you haven't. Have the decency to do the right thing and make the right decision.
Last question. SONA, sa Monday, SONA ni President Duterte, ano kung gusto niyang or gusto ninyong madinig sa kanya sa SONA sa Lunes? Robert.
Kami sa Alliance of Health Workers, kasi matagal na yung panawagan namin na mag-resign na siya talaga. Sana magkaroon ng panibagong Secretary of Health na ang panawagan na namin yung may kakayanan na mamuno talaga sa isang departamento na nakikita natin yung kanyang hindi negosyo ang pag-iisip, no? So kailangan talaga yung ang pag-iisip talaga is para sa mamamayan, kalusugan ng mamamayan, kalusugan ng mga health workers at hindi negosyo. Isa sa mga sana namin panawagan din na dapat yung budget ng pangkalusugan ay dapat i-prioridad na ngayon. Sana ma-realize na ng gobyerno kasi bulat sa pulpa at ang ating budget pangkalusugan ay palaging kinakat, may budget cut lagi, na sana ito ay bigyan ng prioridad ng ating gobyerno at laanan talaga ang pondo, yung pondo na para sa PhilHealth dapat nilaan yan para sa ating mga government hospitals.
Jaymmee, real quick.
We were hoping na this time SONA, he will mention yung talagang something that is really sincere na magiging compensation and benefits ng mga health workers, that will be given attention and priority. Kasi without us, we cannot win this pandemic. Na sana for the first time magkaroon talaga ng tunay na para sa mga health workers, protection sa para sa mga health workers. Hindi man monetary, pero to ensure na lahat ng mga issues natin, concerns natin will be properly addressed and it will not be whitewashed by some crude statements na alam naman na natin na hindi totoo. And I hope na meron talaga siyang konkretong plano. Hindi lang yung plano ng pag-utang na hanggang kaapu-apuhan ko na magbabayad para dun.
All right, and on that note, thank you so much, Jaymmee de Guzman, nurse at the San Lazaro Hospital, and also Robert Mendoza of the Alliance, the national president of the Alliance of Healthcare Workers of the Philippines. That is all the time that we have tonight. Thank you so much, everyone, for joining us in this episode of Viewpoint. Do catch us live every Saturday regularly at 6 in the evening on the Facebook page of Now You Know PH. I'm Barnaby Lo. This is